or whatever you want to type in there. I do want to have some Q&A towards the end, and I will answer questions in that. So the agenda is to do an intro to the dashboard. I'm going to talk about some basics, and then we're going to get into dashboard features. I'm going to kind of jump around to different pages in the dashboard. We're going to talk about different measures in the dashboard. Probably not going to get into every single one in detail, but I'm going to kind of jump around and focus on some of the highlights there. And I'm going to hit on all the different dashboard pages. And then part of this will be a live demo. So I will go into the dashboard. We're going to go over the new COVID-19 dashboard page and go over some of the additions we made in there. And I'm going to give you a sneak peek actually of what's coming in the next dashboard update on that page. And you guys are actually the first to see this. We haven't even played this back at PCC or demoed this at PCC. So you guys are actually the first to see some of the new stuff coming in the COVID-19 dashboard, and I'll show you that later as well. Okay, so at this point, Grace, let's start up that poll. I want to get an idea of, for each of you that are attending here, how often are you using the dashboard? And so the poll that we're putting out there is just to give an indication of whether you're logging into the dashboard on a monthly basis or weekly basis, or if you're new to the dashboard and really haven't seen it at all, or maybe have just looked in there a couple times, or if you're a daily user and going in all the time. I just kind of want to get an idea of the experience of the folks attending this, where you're at with the dashboard. So what is it? It's a tool to inform our clients of the financial and clinical health based on your performance in a variety of areas. So it's pediatric specific data that is in here, and it's your data. It's for your practice. So we have financial measures and clinical measures in there. Okay, so let's talk a little bit about usage of the dashboard. So what we've found over the years is the practices that are using the dashboard the most, and I've listed 20 of those here. This is based on logins over the past year, the PCC clients and the practices that have logged in the most over the past year. And I wanted to highlight them here, and we actually just recently went through these, and for these practices, I wanted to say, okay, what's the average pulse score for the clinical pulse and financial pulse? How are these practices doing, the people that use it the most? And it turns out, I mean, you can see there the financial pulse on average for the top 20 dashboard users is about a 77, or is 77. And that's the 77th percentile of PCC clients. And it's similar for the clinical pulse too. So what this means is that the people that are using the dashboard the most on average, these are our top 25% in terms of the overall scores and pulse in the dashboard. So the point is that I wanted to emphasize here is if you want to be successful as a practice, I think it's extremely helpful to pay close attention to the dashboard, to measure your performance on various financial and clinical measures. Take action on those. So we're going to talk throughout this session about what you might want to look for and what you might want to focus on at your practice, and how to identify those areas. So taking action on what you see in the dashboard and your practice operations and performance is an important thing. And then to measure again. So go back to the dashboard again. We update this. Some of the information is actually updated daily now, but most of it is updated monthly. We update this each month. So come back next month and see if you've improved or improved your performance. Now, so some of you may be wondering about the dashboard awards. So if you've attended our users conference in the past, you know that during lunchtime on one of those days, we do dashboard awards. So we go through all of our client dashboard results over the past year, and we identify the ones that are come out the highest in various measures. Our plan is to do some sort of dashboard awards during this virtual users conference. So it'll probably be a little later, and we'll work that out. We're still working out the the way we're going to do that. So stay tuned for that. But we do plan on sharing some dashboard awards. And if you're not familiar with what this is or haven't been to a users conference, we look at measure results for our clients and rank them and reward or award the top 5 practices. And we may do that a little bit differently than we've done in the past, but we are planning to do something like that. So stay tuned for that. All right, so dashboard logins and data. So there is one login for each practice. All right, this is accessible from within your reports window in the EHR and the Practice Vitals Dashboard. You can get to it from there. You can also get to it from the web as dashboard.pcc.com. You can log in there if you know your login and password. If you log in from the EHR, you do not need to enter your login and password. It'll just get you logged in. Data is collected on the first Saturday of every month. So overnight on that first Saturday, we run a ton of different reports and load that into a database here at PCC. That usually takes a few days for us to load it all in and check it. So usually by like the Wednesday after the first Saturday of the month is when that dashboard is updated for you. It's all pediatric specific benchmarks. So everything you see in here is pediatric specific. So the benchmarks that we show are PCC averages. So for various measures, we'll show the client average. In some cases, it's the median. And we also show top performers. So we like to highlight the measure result for the top 10% of PCC clients, that 90th percentile. We represent that as the top performers. And for some measures, we also have HEDIS benchmarks. If you're familiar with HEDIS benchmarks, these are national benchmarks shared by various payers nationally, and those are represented in the dashboard for some measures, including immunization rates and well visit rates and so forth. Dashboard scoring. So in the when you first log into the dashboard on the home page, you're going to see a bunch of scores, a bunch of measure results. So we have it's well over 20 measures at this point that are calculated monthly. They're scored monthly, and it's based on your relative performance compared with other PCC clients and your performance there. So you're going to see that ranked on the home page by score. So the lowest score going up to the highest score. We have a top priority section that we've identified as the top 3 measures that you score the lowest in that you might want to take a closer look at and prioritize that. For each measure, we define, and this is a little bit about how we do that scoring. So for each measure, we define the values that correspond with a score of 0 and 100. So every measure is scored from 0 to 100, and we calculate that by basically how far you are from that 0 score or 100 score, and we have a calculation in there that measures that, and we look at the variance for the measure, like how far apart are our client results for a particular measure, and other aspects. But that's kind of the details about how that score is calculated. You'll also see some location adjustments in the dashboard. So for some measures, like revenue per visit, for example, that's total collections, total deposits on it for an average visit. Well, that can vary depending on where you are in the country. Your cost of living, a practice in, say, Manhattan is very different than a practice in rural Alabama, for example. The revenue per visit for a practice in Manhattan should be higher than the practice in rural Alabama. So we, in order to benchmark accurately and compare practices regardless of location, we do some location adjustments for some measures. Is it perfect? It's not perfect, but it is a way that you can sort of make that comparison regardless of where you are in the country for some measures and the measures that it's needed for. We look at if you're familiar with RVUs, we look at the Geographic Practice Cost Index that is released each year for various locations throughout the country to do that math. I'm not going to get into how that's all calculated, but Essentially, if you're looking at revenue per visit, you'll see a location adjusted version. And if you're in a relatively high cost of living area, your location adjusted revenue per visit may be a little lower than your actual revenue per visit. And it just allows you to make that comparison. In the dashboard, we also have provider breakdowns. We do this for some measures, not all, but some measures we give you provider breakdowns. And that's typically done by primary care provider, PCP. So for things like immunization rates and well visit rates, we'll do a PCP breakdown. So you can see some measures by provider. All right, so I want to talk about maintaining patient flags. So for your patients, if they are inactive or they move out of the practice or transfer out of the practice, you obviously don't want them included in your measure results. You can flag, as you should know, on your system, you can flag patients with a status flag, and you can create your own status flags. And this is all configured on the partner side, on the partner configuration in your patient flags table. You should have inactive and transferred or hospital only. These are flags that you can assign to patients that you know that are inactive at your practice. You don't want them included on your measure results. And you should do that. So our recommendation is to review those flags on a regular basis. And if you look at each flag entry on your system, you'll see the question at the end. I'm actually pointing to the wrong question there, but they exclude these patients from reports. That question, if that's set to yes, then any patient with that flag will be excluded from dashboard measures. So if anything, one of the things I'd love for you to take from this is to take a look at your flags table. A lot of people don't realize that you can have some patients excluded from measures based on that flag, and check that last question on those. Yes, be sure to routinely flag patients who shouldn't be included on these reports, as I mentioned with those examples. Monitor your dashboard overdue lists. So as you'll see when I get into the dashboard demo, you have overdue lists for a lot of measures. These are identifying patients that are overdue for well visits or immunizations or whatever. Monitor those lists on a regular basis. Get into the dashboard after it's been updated each month and look at that. And if you see somebody on that list that you know isn't active, then you know you need to flag them. So that's why we put those lists in there, is to help you sort of manage that population. Also in the dashboard, so every measure has a trend graph. We keep track of your past results for all of these measures. There is a downloadable CSV file where underneath each trend graph, you can click that link. It'll download a CSV so you can see your past results. So check that out for each measure. We have recommendations in the dashboard for each measure. So there's a section, and we did this early, from the time we started this dashboard, 10, 12 years ago, whatever. One of the initial things we wanted to put in the dashboard was some guidance, some recommendations. We didn't just want to throw data at you. So for every measure, we have information. We have links to resources and documentation. We have suggestions on what you can do to improve your results. And we thought that was really important to include in there. And a lot of dashboards you'll see out there for various products don't have that, but I thought we thought it was very important to have that. So you'll see many dashboard pages are fairly lengthy. There's a lot on there, but these recommendations are really key, I think. And I urge everybody to check those out, check the links, especially if you're a new PCC practice looking for guidance on how to use our tools and how to improve your performance. Also, the other thing you can do in the dashboard, another thing you can do in the dashboard is to identify your recall opportunities. So we put these counts and links and lists of patients that are overdue for their patients or overdue for their visits, whether it's a vaccine, whether it's a well visit. We put that in there so that you can identify your opportunity for recall. And we do that for various measures, whether it's well visits or vaccines, as I mentioned, or screenings, or chronic disease management for like your ADHD population and so forth. We have these lists in there as and measures in there really as a way to identify the opportunity to recall them. Additionally, getting back to the recall opportunities, I wanted to point out that the dashboard itself, as I mentioned early on, it's updated monthly. Once a month, that data is updated. So that means if you're looking at your overdue list, and like say now at the end of May, that list was last updated on May 2nd, that first Saturday of the month. That's when we last collected your data. So you're looking at a list that is a little bit outdated at this point. Some of the patients may have been caught up. So just know that when you're looking at those dashboard overdue lists, we've added recently, I mean, we've had the recaller program in PCC for a really long time. We've added the EHR report library and patient lists and patient recaller within the report library, which is much more robust than the recaller really ever was. You can do a lot more filtering on clinical data. Those are the places really, when you're thinking about recall, we urge you to set up your lists in there because it's active as of the time you're running the report. You're going to get your overdue list as of that time. So don't forget about those tools in the report library for that purpose. There are related tools. There's a related tool section for most measures in the dashboard that we've added over the years. We've added other pages that are related to a particular measure. Like this right here, we're looking at in this screenshot is revenue per visit. The revenue per visit, obviously, you can break that down many different ways. You can start looking at your payer mix. You can start looking at actual charges and payments for a given month, or other state or regional benchmarks. We've added those tools as other sort of underlying resources that you can get to. And those are all generally in the related tool section. And it's basically just other breakdowns, other data that we've created over the years, other dashboard pages that we've created. I also want to mention that the dashboard is useful for practices that are doing PCMH recognition. So I'd love to hear, this is an opportunity to actually put on the Mattermost live session channel. I'm curious to hear if there are practices out there that have done PCMH and have used the dashboard for that and how it's been helpful for you. Feel free to just share a comment on that. I know many of you have used the dashboard for PCMH, and we've actually created a page that's a separate tab for PCMH, and I'll show you that in a little bit when we get into the demo. But it's broken out into the different criteria that are required for PCMH. But basically, it's also a page where we summarize all the measures, all the clinical measures that we have in the dashboard. And you'll see in a second why I think that's useful, a very useful page, whether or not you're doing PCMH medical home recognition with NCQA. If you're just interested in quality improvement at your practice and want to see a good summary of your results, this is a good page for that. The dashboard is also a place where you can drill into your AR a little bit more. We have a variety of reports within PCC, like whether it's insurance aging or other billing reports within PCC that are operational and operational in nature. These we also have in the dashboard higher level summary data for the AR. And you'll see that for any AR measure from your homepage, if you go in there and you'll get to the related tools, you'll see a section for a detailed AR summary report. And what that is it's going to drill into your AR. It gives you kind of a high level data, high level view of your accounts receivable and billing. But these are some of the things you'll see in that page. Revenue trends, just in terms of how much you've collected for payments by month or year to date. AR days and benchmarks, AR percentage by aging category. So what percentage of your AR is current, 30 to 60, 60 to 90 and so forth. What percentage is personal versus insurance and other recommendations as well. Also in the dashboard is a patient population page. So we have some population trends where and this is intended to give you an idea of how many active patients that you're seeing at your practice, how many active patients that you have at your practice. We collect this each month. We do a snapshot of this each month, and we show it for various age ranges. So you can do things on this page like monitor the intake of newborn patients to your office. So how many newborns are you bringing in each month? Well, we give you a subtotal, and we'll look at this a little bit in a second. We give you a subtotal of under 15-month-old patients, an active patient count as a snapshot each month. Well, you can monitor that, and if you're increasing your population of kids under 15 months, you know that you're adding more newborns to the practice. So it is one way you can do that. And you can just monitor your patients of various other age ranges as well. You can filter by PCP to get an idea of how many patients each PCP has on their panel as well. All right, so this is what that page will look like. And again, we'll look at that in a second here. I want to mention that the dashboard can be used for keeping payers honest. So we have in various places in the dashboard breakdowns of measures by payer. So if you're working with insurance companies and they're measuring you based on your performance for well visit rates, for example, and I know that's a common situation where you have a pay for performance program, maybe you get incentives based on your performance for well visit rates. The dashboard can be used to check that data. If they're saying that you have, I don't know, 1,000 patients within the 3 to 6 year old range that they're measuring you on for well visit rates, and you look at the dashboard and you're seeing like 500 patients, then you know that they're including patients that may not be yours or may not be really active at your practice. So the dashboard does do breakouts by payer in various spots. And that's just one example where you can use that to check, to sort of keep payers honest and check their results, check the measure results that are being reported to you by your payers. Compare your overdue patient counts, like I said. Use this data as leverage when you're negotiating. So if you're working with payers on a contract or negotiating a contract or trying to renew a contract, it'll be good for you to have this data and really know how, and report to them and show them how you're doing for their patient population. What are the immunization rates for your practice for that population, for that payer, and report that to them and just show and use that as leverage. If you are a top performer or a high performing practice and have close to 100% of your active patients up to date on vaccines for that particular payer, use that as leverage. Use that data as leverage and show that you're tracking that. In the PCMH dashboard, there is a section, it's labeled as QI05 for measuring health disparities. There is an ability to break out by insurance. So we put this in here for PCMH because it's useful for practices to say, if you have Medicaid at your practice, you can look at what's my Medicaid performance for a particular measure versus other payers. That is one thing you can do for PCMH. It's very relevant for that. But you can also just see this by not any measure, but most measure results by payer. And that is on that PCMH dashboard page. It makes it easy for you to do that. All right, so at this point, I'm going to take a pause for a second. Now, we had a poll going that Grace did because I was curious on what practices had for experience on this. So I'm just going to check this out. Grace, you can stop that poll because I'm curious for the folks attending this, what level of experience that you've had in here. Yeah, any last input? Closing it down. Okay, good. While we do that, I'm going to jump into stop presenting. I'm going to jump into a dashboard page. So you guys should still be seeing my browser. Let me know if you do not. I'm going to get into a demo dashboard. Okay. I'm going to move move this. I should have done this before. Okay. Take a look at the feed here. All right. Yeah, so I'm just referring back to this poll here. Poll has ended. All right, so most of you once or twice a month. Some of you actually daily or almost daily. That's great. Once or twice a week. A couple of you and others of you have used it a few times. So that's great. Thanks for sharing that in here in that poll. Let me get into the dashboard here. I'm going to jump around into different sections. The first place I want to focus on is this COVID-19 page. I just want to show you what's in here. Most of you probably have seen this. We've had this out for over a month now. And really what this is meant to do, or the current version of this is meant to do, is give you information about your practice over the last few months in terms of your visit volume. And give you an expectation of for this first initial data, and at least the financial impact of COVID-19 on your practice. We're looking at your total charges and your total payments. We actually give a projected payment identification of what you might project going forward for payments based on your past weeks of charges. So this is all measured on a weekly basis, okay? We collect this data on a daily basis, actually. So this is the first time in the dashboard that we've started collecting data daily. We're loading this into the database daily. The numbers are reported on a weekly basis, as you can see, and we do that throughout here, but this is refreshed each day. This first indication gives you an idea of your weekly charges and payments since the middle of February going forward. So you can get an idea. I mean, for everybody, or most everybody, in mid-March, there was a big drop-off of charges and productivity and visits that you're doing. But it's a good idea to look at this graph and get an idea, how am I doing since then? Are my weekly visits and charges and payments going up? So you can monitor that here. As I scroll down, I want to just point out a couple other things here. We also get into the charge and payment analysis, and we show this relative to your practice and relative to your baseline, which is the productivity you were doing back in February. Okay, so the baseline is February 17th through early March 8th. Okay, what for the weeks since then, what percentage of charges and payments are you seeing compared to that baseline for each of those weeks? Is it a good comparison? I mean, like February, that baseline period was a really busy time for many of you. It was middle of flu season, middle of sick season, so you were busy during that time. So obviously, yeah, you're into the spring months. It normally gets slower this time of year, so you're not expected to be at 100% of mid-February charges, for example, in the recent weeks. But this gives you an idea of how you're progressing and how quickly or how quickly you're getting back to your norm of charge levels, and also what the PCC average is. So the blue lines on these graphs are giving you an indication of where other PCC practices are. So one of the reasons why we put this out there is to make sure everybody knows that you're not alone with this. Every practice is really seeing a big drop in charges and payments as patients are staying home and not coming to the office as much. We wanted you to get that comparison to other PCC practices, and also an indication of that things are not normal yet. Obviously, it's never going to be the same as it was, but it's moving. It's increasing. More patients are coming in for well visits. Telemedicine has seen an uptake. Many practices are doing that. So you're bringing your productivity back up closer to where you were in the past, and you can measure that for your practice against the PCC benchmark, and that's really what we're doing here. And then we get into a breakdown of well and sick visits. We wanted to give you an idea of, for the weeks in the past, how many well visits and sick visits are you doing at your practice? And this is measured in terms of weekly numbers, weekly visit volume. So you can look at this and get an idea of your weekly volume and how many well visits versus sick visits you're doing. It's a visual of your well to sick ratio in some respects. And then lastly, we get a sick visit modality breakdown. So as practices are starting to do telemedicine at your office, or doing billing over via portal visits and phone visits, we wanted to give an indication of how many visits you're doing that are telemedicine versus in office or other modalities. And this is focused on sick visits, and we show that here, along with a trend, an average trend. So you can see, like most practices, by early April, we're up to about 40% of their sick visit volume being done via telemedicine of some kind. This practice, as we're looking at in this demo, was like almost 100%, and they still are close to 80% of their business being done, or sick visit volume being done via telemedicine. So this gives you an idea of your trends for that on a weekly basis. I'm going to do a sneak peek now of what's coming in the next dashboard update. So bear with me a second as I get in here. So this isn't ready, this isn't done. We're not going to release this just yet, but we're getting pretty close. So for this, what we wanted to do next is, we know insurance companies are starting to pay for telemedicine. So since early on, we're curious, okay, how much are insurance companies paying for telemedicine? Are they paying at parity with what you are getting paid for in office? Are there certain payers that are not paying on par with what they're paying for in-office visits? And so this next update that's coming will give you an indication of the percentage of payment for telemedicine versus in-office. And that's really what we're showing here. We're looking at paid visits, fully paid visits, so far this year, whether it's telemedicine versus in-office. We're focusing in on sick visits in this analysis here. And we're giving you an indication of how much you're getting paid for telemedicine versus in-office, and how much you're getting paid from your top payers. We're giving you a visual of your top 5 payers, and then separating all other payers onto their own line here. The percentage of telemed payments versus in-office. We're going to give you the ability to break this down by insurance. So, and by code, by sick visit code. So if I'm in here and I want to see, okay, Blue Cross is one of my big ones here. How much is Blue Cross paying me for a 99213 via telemedicine versus in office? And that's really what we're going to show here. So you can see they're paying about 98% for telemedicine compared to in office, and for 99213. But for 99212, you haven't billed many of them, but they're paying much lower, or considerably lower. So you can do this for any insurance. So this next update is really going to get into the payment levels, and our goal with this, or one of our goals with this, is to inform you of payers that are not paying up to par, or not paying as expected for telemedicine versus in office. And if they aren't, to take some action and to reach out to them. This is important to do because, I mean, as you can imagine, telemedicine is not going away. You're going to be doing this for a while. In particular, for some of you, it's worked out better than others. But we want to make sure insurance companies are paying adequately for that, and you want to make sure too. And that's the big purpose of this particular page. All right, so that's the COVID page. I wanted to highlight that. I'm going to jump back to the home page here. And I'm going to jump around because I realize some people only allocated an hour for this. We started a little late, so I might end up going a little later than expected. I'm going to jump into some measures here. I want to focus on some specific things here. I'm going to start with well visit rates because I think this is one of the key measures in the dashboard. When you go into well visit rates, we do a breakdown of well visit rates for various age ranges. Under 15 months, 15 to 36 months, 3 to 6 years, 7 to 12 years, and 12 to 21 years. So we focus on different ranges here. And for each range, like if I'm looking at the 3 to 6 year olds, we give you a score for your performance. And that score is calculated based on your performance relative to other practices. And we give you benchmarks of where you are compared to the averages, compared to the top performers, and compared to HEDIS measures as well. So you can get an indication of that. We can get an indication of which patients are overdue. So if I click this link here, I get a list of all of the patients that are overdue for the well visit in that age range, and how many of them are there. Included in that list are patient flags if they're scheduled for another visit. So we give you that information there as well. We give you a detailed breakdown for each age group. So I want to point this out too. For each age range, you can break down by insurance. You can see what are my well visit rates for kids 3 to 6 years old by insurance. So we do that here. We can do it by PCP or any of these other categories here. From any measure page, you can get to a specific measure if you wanted to focus on that. So that's well visit rates. I'm going to jump to an AR measure here. And I want to point out something about your AR measures that all of you are really seeing at this point. At the top of the page, and you'll see this throughout the dashboard, we have this big red indicator here, and this is newly added within the past few weeks. Some of your measure results, particularly AR measures, are going to look really weird over the past couple months, and it's for the simple reason that you're not seeing as your volume, visit volume, your AR over the past couple months is much lower than it normally would be. Your charges are much lower. Well, this impacts your AR measures, your accounts receivable measures. Specifically, if we're looking at AR in the last 90 days or so. So this measure, for example, is like percentage of your AR 60 to 90 days old. Well, that's going to be a lot different than it was in the past. You may have a lot more higher AR in that category because you have such a smaller percent in your current or 30 to 60 day category. So keep that in mind here as you're looking at AR measures, that it's going to look a little different these days. Jumping back to the home page here. I'm taking a look here at the comments and questions. I want to make sure I answer these questions before we go here. I see a message here. Is the weekly visit data based on patients' billed data or patients seen scheduling data? I'll answer that question right off here. The weekly visit data on that COVID page, I presume that's where the question is coming from. It's based on billing data. So all of that is based on visit billing data. So not necessarily the patients that have actually been scheduled, it's based on billed. So what that means actually, and I'm glad that question came up because this is an important point. If you have visits that you're a little delayed on putting in or billing, they're not going to show here. So keep that in mind when you're looking at particularly like last week. So last week was the week of May 18th. If you haven't put in all charges for last week, that's going to be incomplete. But the reason why we collect this data daily is that we can refresh this on a daily basis. So that say after today, the 29th, you know that your billing staff has finished posting all the charges for last week. Well, after today's collection, you know that last week will be complete, and your charge data will be complete. So keep that in mind. It's based on billing data, what you've actually billed out. Will you please repeat the time frame for when the data is updated in the dashboard and when it was published on the dashboard? So for all other measures, aside from this COVID page, it's on a monthly basis. So we collect data on the first Saturday of every month. We do it on the weekend and we do it on the Saturday because we have to do this overnight. For many of you, this data collection takes many hours to do. We don't want to conflict with updates that we do on your system, which happens on Sundays. So first Saturday of each month, we collect it. We have to make sure we collect it for everybody to build our benchmarks. And so there's some data transfer and data storage and data checking that happens over the next few days. So usually it's like the Wednesday after the first Saturday of the month when your dashboard will be refreshed with that new monthly data. Okay. All right, so getting back here to some measures, weight assessment and counseling. So we have this measure of how often you're collecting BMI for your patients and how often you're counseling them for nutrition and activity. This is a common HEDIS measure. Many of you have probably seen insurance companies reporting on this. We've added it in there because it is a common HEDIS measure. It's BMI assessment. So many of you are scoring really well. You can see the benchmark here is really high. For the counseling, nutrition and activity counseling, you'll see the benchmark is really low. In PCC, in order to track this, you have to be triggering a certain SNOMED code during these visits. If you're reporting a 0% for this, as this demo practice is seeing, it just means that, and you know that you're doing counseling and for nutrition and exercise. That just means that you're not configured properly to track this counseling order. And you'd want to get in touch with your CA, client advocate, about that to get that set up. So if you're seeing a 0% for that, that's why. I want to highlight this fluoride varnish rate measure. This is a measure we added years ago that is meant to show the percentage of patients between 1 and 5 years of age who had a well visit in the last year. How many of those received at least one fluoride varnish application in that year? This is based on billing data. You would have had to bill out that fluoride varnish application to have this counted for this measure. We added this in here because it is a recommendation by the Bright Futures Net. We have a link here to some Bright Futures information that does now include, for kids of a certain age, a recommendation for fluoride varnish. Most practices are billing that with a 99188. That is the appropriate code, CPT code. Some practices are using the dental, the D1206 code for that as well, per payer requirements. So that is another measure in here. All right, so just for reasons of time, I'm going to jump to this PCMH page and a few other highlights here that I wanted to mention. I find this PCMH page is probably going to be the most helpful if you wanted to sort of see a summary of your clinical performance for all measures in the dashboard. This page has it. You can print this page. It's not the most printer-friendly page, but you can print this page from the browser. And it will identify the number of patients, qualifying patients, number up to date, a percentage, and then an indication of how this has changed in the last 3 months. So remember early on, I said one of the key things to do is to have a successful practice in terms of financial and clinical measures is to measure, take action on those measures, and then measure again. So this page is good to get an idea of your improvement, or if you're improving, or if there are certain measures that you need to take a closer look at because you're seeing a big drop. So for this practice here, they've seen a 3.1% drop in immunization rates for kids under 2 years old. That's significant. That's something that you'd want to highlight and take a look at. We do this for all clinical measures in the dashboard are summarized on this page. Depression screening rates for adolescents is another measure we have in here. That's the percentage, and if you click on that, you'll see it. We're on percentage of adolescents who had a well visit in the last year. Did they have a billed depression screening code at some point in that last year? It doesn't have to be at the well visit. It could be any time that year. Could be during a sick visit or a checkup or something like that, but did they have that depression screening billed? That's what this measure is showing. Okay. Other measures in here. So missed appointment rate is another good one to keep an eye on. We show missed appointment rate in the dashboard. We changed this a year or so ago to reflect appointments over the past 3 months only. We used to look at a whole year's worth of appointments for this. But if you're looking at this and making changes at your practice to do different notification styles or reminder styles for appointments, you may want to track your progression or your performance on this in a more recent time period. That's why we changed to a 3-month period for this. So again, this is based on appointments being marked as canceled, marked as missed at your practice, and it will track for that. All right, so I'm going to jump over to the questions again here. And at this point, I want to encourage anyone that is one of those practices that said they use the dashboard daily or are frequent dashboard users. If the dashboard has improved your practice at all, or if you've used this for anything positive or improving at your practice, mention that here in the quotes. I'd love to hear how this dashboard has helped practices, and to be able to share that with others would be fantastic. Are there any other questions here that I missed? Grace, let me know if, and I answered that one. Let's see. Need a way to reflect kids who are already established with the dentist and therefore don't get fluoride in our offices. Okay, yeah, that's a good point. So the fluoride varnish measure is looking at all patients. It doesn't exclude patients with certain flags. If you may have, like for that example, with kids, if they get it at the dentist, you know they got it at the dentist, they're getting it regularly, they don't need it. There isn't a way right now to exclude those with a SNOMED or ICD-10 or something like that. But keep in mind that fluoride varnish can be done depending on the age of the patient. I think it's, I don't know if the recommendation up to six times over the course of a certain age period. So it may be more than the once or twice a year they might be going to the dentist, is my point there. So it may not be a bad thing to still give, even if they are going to the dentist, and kids miss dentist appointments too. So, okay. And Grace, again, let me know if there's any other questions. Oh, Sarah, I see you talking, but I can't hear you.
I do have a couple questions for you.
Okay.
You can hear me, right?
Yeah, I can hear you now.
Okay, so one of the questions that came in earlier, I don't think that you saw, was when you have a patient who refuses a vaccine, for instance, flu or HPV, does entering the refuse order take them off the dashboard measures? I'm going to ad-lib on that one a little bit because there are two possibilities there. Entering the refused order, there is a refused order for many vaccines in your system. There's also the refuse button that you can for an order.
Mm-hmm. Yeah, that's a good question. So we do not exclude patients from a measure if they are marked as refused. And there's a reason we do that. We want to reflect the measure result consistently across all clients. And the HEDIS measure result, for example, it doesn't exclude patients that are refused. There is a contraindication refusal or a contraindication exclusion that is applicable. We don't have the contraindication for a vaccine built into this, but that should be pretty rare. There are a lot of patients that refuse vaccines. The answer is that we still include them as overdue if they've refused it. And we do that just for consistency's sake for measuring here. I just happened to pull up this immunization rates for adolescents measure as we were talking about vaccine rates. I wanted to point out that this is one that we updated. It's probably a year ago now, or maybe even more. But this is a page where you can get a breakout for adolescents, immunization rates for adolescents. You can do it by individual vaccine here. So not just the whole series of 3 vaccines they should be getting as adolescents by age 13, but you can see it just for HPV or just for meningococcal or Tdap. So if you wanted to focus on one vaccine in particular, you can do that here in the dashboard. Sarah, were there any other questions I didn't get to?
Yes, I think we had another one. Is there a way to know how many patients, I should have pulled it up on my screen. Is there a way to know how many patients we saw yesterday? For example, based on appointment data, not billing data. We'd like to see actual numbers closer to real time rather than waiting for billing.
Yeah, so there isn't any appointment data that we're showing in here. So there really isn't. No, most of what you're seeing in here is all based on billing data, what you've billed out. We've considered on the COVID page, for example, to give an indication of what percentage of encounters maybe that hadn't yet been billed. That I think could be useful on this page, and we thought about including an indication of that here. But no, yeah, so there isn't any report of appointments that are actually scheduled or even future appointments scheduled that we have in here. Like the productivity tab here, I haven't got into this and I probably won't have time to, but that's all, again, based on past billing data. And again, I want to also say here, feel free to share with your CA or myself or others at PCC. If you have wishes or enhancement requests for the dashboard and other measures, let us know about those so we can record those and think about it. We're constantly thinking about this dashboard and ways to improve it. We've talked about better graphing tools, for example, and other platforms. There's a lot of opportunity and for us with dashboard. We have a whole project at PCC about leveraging pediatric data. So we're talking a lot, and we got a little sidetracked with COVID and all the work we've been doing with that. But we're going to get back to that very shortly and talk about other ways of improving our reporting. So let us know if you have suggestions about other measures or other ways to show this data. All right. Anything else, Sarah, that I may have missed?
I see there are some comments in the chat, but I don't think we have any further questions.
Okay.
Yes.
Yeah. I know I didn't get into all of these measures, but as sort of a parting note, I guess I'd say I encourage everybody to go into your dashboard. I showed you how to get to it early on from the reports menu in the EHR. Check it out, look at your measures. I think I saw a note from somebody earlier that new practices, it takes a little time for some of these measures to really update, especially the financial side of things. Keep that in mind, be patient with it, and your dashboard measures will get updated over time if you're a new practice. But I urge everybody, if you haven't had much experience with the dashboard, check it out. See if there's measures in here. If you see a measure that you have a question about, contact your CA, talk to us about it. Let us know if you have questions or questions on how it's calculated or what you can do to make improvements. That's definitely stuff we want to be able to address with you. I know we're over time, so I don't want to go much longer here. Are there any other questions before we finish this up?
No other questions coming through the chat, Tim.
Okay. All right, I guess I'll wrap it up there. Thank you, everybody. Thank you for being patient with the technical difficulties at the beginning.
Yes. Thanks, everyone, for being patient. Thank you for attending. Just a reminder that recordings, this session is recorded, and recordings will take up a few hours to process. But as soon as they are ready, you will find them at the pcc.com/UC-2020 link under past sessions. Thanks very much, everyone. Have a great weekend.
Thank you, everybody.